You're watching John Beard and Christine Devine with LA's #1 choice for news at 10. The Fox 11 10 o'clock news.
Botox, facelifts, cosmetic surgery. Many people are trying to change the way they look. Some are using injectable fillers to make their wrinkles disappear. If you want to improve your look with injectable beauty, Lila Strogoff reports on things you should know in this Fox 11 investigation.
Injectable fillers, products that promise to plump, pad, and rejuvenate. Just a year ago, they weren't considered a real alternative to plastic surgery by many patients. But today, new fillers are becoming substitutes for surgery rather than just supplements. One doctor tells us his filler business is up 25% so far this year over last.
Fillers are the fastest growing segment of the cosmetic community. They're just off the scale.
Among the latest FDA-approved products, some permanent fillers like Artifil and temporary ones like Juvederm and Perlane. Dr. Simon Orion is using Juvederm here to fill in the hollows under this patient's eyes.
It's something that's bugged me, and I always look tired, and I've actually slept a lot.
Right now, it looks very good.
Dr. David Duffy says the permanent fillers should only be used for certain problems.
For people with terrible scarring of a certain kind, miracle to those. People whose noses are kind of crooked from surgery.
Dr. Alexander Rivkin agrees. He uses permanent fillers to perform what he calls non-surgical nose jobs, lifting droopy tips and straightening crooked bridges.
I can do things that are phenomenal, that are really cool. Your nose came down a little bit on the tip, and so we managed to raise it up, make it straight.
I love it. I couldn't be happier.
But Dr. Cynthia Boxrud warns the trouble with all these fillers is that not all doctors use them correctly.
When we place fillers in the face, the most important thing is safety. One needs to really understand the anatomy exquisitely.
And if they don't, the complications can be severe, from scarring to puffiness, discoloration and lumps, even blindness.
There are arteries that run right up in here. They plug the artery, you go blind.
Dr. Boxrud says the most common problem, injecting too much.
I've even had some patients that have had overfill where they can't chew properly.
Catherine Mitz came to Dr. Boxrud for help because of what another doctor did to enhance her lips.
I had these huge lips, and everybody looked at me like this. If you put red lipstick on, you look like a baboon. I mean, it's horrible.
Dr. Boxrud says Mitz can laugh about it now because she had a temporary filler. Eventually, it subsided.
You have to be careful.
Dr. Duffy stresses that with all these legitimate fillers, when they're used correctly, irreversible damage is very rare.
None of them are perfect, but used properly, they're all quite safe.
Bottom line,
Make sure that you know the reputation of the person who's injecting.
in Los Angeles, Lila Strogoff, Fox 11 News.
If you want more information on a doctor through the medical board or on the doctors featured in this story, visit our website, myfoxla.com.